This is the second video on hepatitis C and will discuss investigations. What tests are done to confirm hepatitis C? First test that your doctor will do is a blood test. The blood test is done to check for the HCV antibody. Antibody is a protein produced by the body's immune system in response to an infection by a virus or bacteria. If this test is positive, the doctor will need to do another test to confirm hepatitis C. If the test is negative, it means that the person does not have the virus unless they have been recently exposed to the virus. In this situation, they will need to be tested again. In most people, in this situation, the antibody test will be positive 4 to 10 weeks after initial exposure. The test to confirm hepatitis C is called the Hepatitis C RNA PCR test. A positive test confirms that the patient has hepatitis C in the body. The test is usually positive 2 to 3 weeks after initial exposure. The test can also measure the viral load, which is the exact measure of the number of virus in the blood. Next, the doctor might do blood test for hepatitis C virus genotype. It is important to know and understand hepatitis C genotypes because different genotypes respond differently to medicines that treat and cure hepatitis C virus infection. Next, various tests are done to help the doctor to assess the damage, if any, to the liver and also to choose the correct medicines to treat the illness. Blood tests, namely liver function test. Liver enzymes are typically elevated when there is damage to the liver. The two enzymes that are measured are called ALT or alanine transaminase and AST or aspartate transaminase. In 1/3 of patients, these liver enzymes may be normal. The enzymes fluctuate and may be elevated for a period and then go back to normal after that. Other blood tests done include the full blood count and renal test. The second test that's done is an ultrasound of the liver. This looks at the extent of liver damage, whether there's any fat in the liver, any tumor in the liver, and also looks at the gallbladder and the bile duct. The bile duct is the tube that drains bile from the liver to the small intestine. This is a routine test that is done in patients with liver disease. There are 3 types of tests to look for liver scarring and fibrosis. It is important to know how much fibrosis is present in the liver, as management depends on this. The doctor is more likely to start treatment if there is a lot of liver scarring or fibrosis. The 3 tests are a scan that measures liver stiffness. These scans are like an ultrasound but use low frequency sound waves. These tests are painless and non-invasive. They measure liver stiffness. The greater the stiffness, the greater the fibrosis. One such scan is the FibroScan. Another test is a blood test which measures scarring by checking the blood for markers of fibrosis. One such test is the Fibro test. Another new method of looking for scarring is the MRE or the magnetic resonance elastography. This is a new non-invasive method of looking for liver scarring or fibrosis. It uses magnetic resonance and sound waves. MRI or CT scans are imaging tests to look for liver cancer. Finally, we have the liver biopsy. This is the best method to look for inflammation and fibrosis. A small piece of liver tissue is removed from the liver using a needle. However, it is an invasive procedure and can occasionally result in bleeding into the liver. Non-invasive tests that I've mentioned above, like the scans and blood tests, have largely replaced liver biopsy as a tool for looking for scarring or fibrosis.